El Salvador is joining the list of Latin American countries urging women to delay getting pregnant. It's concerned about the Zika virus carried by mosquitoes and linked to birth defects. El Salvador is telling women to wait 2 years to have children. 20 countries have cases of this virus, with Brazil by far the hardest hit. CCTV's Paulo Cabral traveled to one city to see how it's coping.
When Fernanda da Silva was 8 months pregnant, a sonogram showed her unborn baby had microcephaly. Further tests indicated that little Isabella was a probable victim of the Zika virus, a mosquito-borne disease her mother caught during pregnancy.
Of course I was very tense, but I was more prepared for it because I had been told about it already before she was born. But I kept asking myself, why did it happen to us?
Aí eu fico me perguntando, né, porque ela nasceu assim, né?
It won't be easy for her to deal with the special and often expensive needs of Isabella. Fernanda lives with her mother and father, 6 brothers, 4 nephews, and now her daughter in a small 2-bedroom house in a poor suburb of Recife, capital of the Brazilian state of Pernambuco, the area hardest hit by the Zika virus epidemic and consequent spike in cases of infant deformities. Doctors at the Osvaldo Cruz University Hospital were among the first to notice the rise in newborns with microcephaly. It became a daily routine to see mothers here looking for help for their babies. Most of them are from poor areas of the state where the lack of sanitation contributes to the proliferation of mosquitoes.
Tem muita diferença.
This is my 4th child, and I notice he's different from the others when they were babies. He does not smile. He doesn't notice when we call him like my other kids when they were 2 months old.
Doctors here say there's a clear correlation between the exposure to the Zika virus and microcephaly, but are yet unable to explain why. The only real advice to women for now: avoid getting pregnant.
I have been a doctor specialized in infectious diseases for over 4 decades, and this was something totally unexpected. There's nothing in medical literature about this, so it was very stressful for us and for the mothers. Many were panicking, and we had to talk a lot to them.
A task force of scientists has been created to study the problem and try to come up with solutions, and the government has designated funding to research a vaccine. But these are all in initial stages. For now, avoiding mosquito bites is the best pregnant women can do. The Zika virus has only recently arrived in Brazil, but the mosquito that spreads the disease, the Aedes aegypti, is well known and a note problem for health authorities here. It's the same mosquito that also carries the virus of the dengue fever, the yellow fever. So the government have stepped up efforts to fight it. The army was called in to help health inspectors look for breeding grounds. It's not easy work. Any container of standing water can hold eggs and larvae. Along the street, every home had at least 1 person infected. The agents go from house to house to check and inform people about the dangers of the Aedes aegypti and emphasize the importance of prevention.
Myself and my 2 sons, 3 and 4 years old, got the disease. It was terrible. We had very high fever, a lot of pain all over the body. Before this, I had unprotected water stored in my house. Not anymore.
80% of the mosquito breeding sites are inside people's houses. And we have been working with community leaders to try and bring information to people about these risks. But it's slow work.
Fighting a new virus and a no-established insect is a tough task for health authorities here and in other parts of the world. But its importance is undeniable for an entire generation at risk. Paulo Cabral, CCTV, Recife.